Thank you for your interest in Medicare Advantage plans from SummaCare. We're a local plan with national reach based in Akron, dedicated to serving our friends and neighbors here in the heart of Ohio. And we're dedicated to making sure that the personal care our members have come to expect is always within reach. What do we mean by personal care within reach? Personal care means that you'll have dedicated Medicare advisors who are ready to provide personal attention and help you get the most from Medicare. And because we live and work here, you can expect to be treated like a neighbor, not a number. We value the relationship between our members and their doctors. Through our network of thousands of the area's providers, we're able to offer high-quality, coordinated care that is focused on you. Medicare is a federal health insurance program for people age 65 or older, people under age 65 with certain disabilities, and people of all ages with end-stage renal disease. Medicare includes 4 components. Part A is hospital insurance. Part B is medical insurance. Part C is Medicare Advantage plans, and Part D is prescription drug coverage. With Part C Medicare Advantage plans, you get all your Medicare Part A and Medicare Part B coverage through the insurance company instead of directly through the government. Medicare Advantage plans that include Part D prescription drug coverage can give you all your Medicare benefits in one plan. There is no need to purchase additional coverage such as a Medicare supplement or Medigap plan or a prescription drug plan. SummaCare is a Medicare Advantage plan. SummaCare Medicare Advantage plans offer more coverage and have lower out-of-pocket costs than original Medicare. For instance, our plans have a capped annual out-of-pocket limit, so you will always know the maximum cost you'll pay if something unexpected happens, like an extended hospital stay. Original Medicare has no limit to your out-of-pocket costs. Most SummaCare Medicare Advantage plans also include Part D prescription drug coverage. But if you don't need prescription drug coverage, for example, if you're a veteran and already have prescription drug coverage, our new Amber plan may suit your needs, since it does not include Part D prescription drug coverage. Our plans include extra benefits not offered by original Medicare, such as dental, vision, free gym memberships through Silver Sneakers, hearing aids, transportation, and home safety devices. And in 2020, many of our plans will include coverage for non-prescription over-the-counter medications and supplies, acupuncture services, and therapeutic massage services. Original Medicare provides Part A, hospital coverage, and Part B, medical coverage. Original Medicare does not cover all of the costs associated with these services. Medicare Supplement or Medigap insurance plans may be purchased to pay some of these costs that Original Medicare doesn't cover, such as co-payments, co-insurance, and deductibles. For example, if you are admitted to a hospital under Original Medicare, you may be responsible for a deductible plus co-insurance for physician charges and fees. A Medicare supplement plan may cover these costs if enrolled along with Original Medicare. Most Medicare supplement plans don't include prescription drug coverage. This must be purchased separately at an additional premium. SummaCare Medicare Advantage plans include Medicare Part A, Part B, and with most of our plans, Part D prescription drug coverage. Also included are health and wellness programs and services designed to help you feel your best. To enroll in a SummaCare Medicare Advantage plan, you must be enrolled in Medicare Parts A and B, and you must continue to pay your Medicare Part B premium each month. You must reside in our 31-county service area. In most instances, if you have end-stage renal disease, you are not eligible to enroll in a SummaCare Medicare Advantage plan. If you have end-stage renal disease, you'll usually get your health coverage through Original Medicare. Please contact us for more information about enrollment if you have end-stage renal disease. You are also not eligible to enroll in SummaCare if you do not live in our service area, or you are not eligible for one of the following enrollment periods. For most people turning 65, you're eligible to enroll in a SummaCare Medicare Advantage plan during a 7-month period that begins 3 months before your birthday and ends 3 months after your birthday. Most people review their coverage during the annual enrollment period. This runs from October 15th through December 7th each year. This is usually the only time of year you can make changes to your coverage, unless you are eligible for a special election period. A special election period is a time outside the annual enrollment period when you can make changes to your Medicare coverage. It is based on certain events happening in your life. Such events might include moving, losing other insurance coverage, or becoming eligible for both Medicare and Medicaid. SummaCare offers HMO and HMO POS Medicare Advantage plans. Our HMO plans give you access to the SC Medicare network of thousands of providers and more than 60 hospitals. Our HMO POS plans offer coverage through any Medicare-approved provider, inside or outside of the SC Medicare network. Out-of-network or non-contracted providers are under no obligation to treat SummaCare members except in emergency situations. Please call our customer service number or see your evidence of coverage for more information, including the cost sharing that applies to out-of-network services. In most counties, our plans start as low as $0 per month. All plans feature a $0 deductible on medical services and offer a maximum out-of-pocket benefit designed to limit your expenses in any given calendar year. When your out-of-pocket expenses, including copays and co-insurance for in-network services, reach a specified amount, the remainder of your eligible expenses for the rest of the calendar year are paid by SummaCare at 100%. You pay $0 for these services. Our plans also feature a $0 copay for in-network primary care visits, a $0 copay for telehealth services through Teladoc, dental, vision, hearing aids, free gym memberships through Silver Sneakers, and new in 2020, most plans will include a quarterly allowance for commonly used over-the-counter medications and supplies. And most plans include Part D prescription drug coverage. SummaCare offers hundreds of Tier 1 preferred generic drugs for a $0 copay to members who reside in our Northeast region. In addition, most preventive care services, including flu shots and wellness exams, are covered at a $0 copay. You'll even have access to Silver Sneakers, which offers free gym memberships to many area fitness locations at no additional cost to you. With all of our plans, you are covered anywhere in the country for emergency, urgent care, and renal dialysis services, and up to $25,000 per year for emergency services outside the continental United States. You'll have the peace of mind knowing you're covered in an emergency or urgent situation, no matter where you are. As we mentioned, Part D prescription drug coverage is included with most SummaCare Medicare Advantage plans at no additional cost. There are some important things you need to know about prescription drug coverage. When shopping for Part D prescription coverage, you've probably heard the terms coverage gap or donut hole. This happens when you experience a gap in Medicare prescription drug coverage and pay more out-of-pocket costs on medications while in this gap. Not everyone will reach this coverage gap or donut hole. It occurs when you and your prescription drug plan together reach total prescription drug costs of $4,020 in one calendar year. Here's how it works. First, if you've enrolled in the Topaz plan, you will have to pay the full cost of your Tier 3 and Tier 4 drugs until you meet your $150 deductible. Drugs in Tiers 1, 2, 5, and 6 do not have a deductible. Note, there is no drug deductible with other SummaCare plans. During the calendar year, you pay predictable copays or co-insurance on your prescriptions based on the tier the drug is assigned within our formulary. When your year-to-date total drug costs reach $4,020, including what you've paid in copays and co-insurance, plus the amount your prescription drug plan has paid, you will enter the coverage gap or donut hole. Not everyone will enter this phase. If you do enter this phase, keep in mind that all SummaCare Medicare Advantage Northeast plans continue to offer Tier 1 preferred generic drugs and Tier 6 vaccines at a $0 copay. In short, there is no gap in coverage for SummaCare Tier 1 preferred generic drugs or Tier 6 vaccines. While in the coverage gap or donut hole, out-of-pocket expenses on prescriptions increase, and your copays will no longer apply. To help reduce your costs, manufacturer brand gap discounts and plan payments for brand name drugs will apply to all your prescriptions. For brand name drugs, you'll pay 25% of the cost and 25% of the cost for generic drugs. If you receive extra help for prescriptions, your copays may be even lower. Remember, SummaCare Medicare Advantage Northeast members pay a $0 copay for Tier 1 preferred generic drugs and Tier 6 vaccines, even while you're in the coverage gap or donut hole. On the other side of the donut hole is catastrophic coverage. If you reach this phase, your benefits actually increase. It is designed to help individuals with extremely high drug costs. You reach this stage when your total year-to-date out-of-pocket drug costs reach $6,350. If you reach this phase, you pay the greater of 5% of the cost of the drug, or $3.60 for generic drugs, or $8.95 for brand name drugs for the remainder of the year. In addition to medical, hospital, and Part D prescription drug coverage on most plans, SummaCare Medicare Advantage plans include a variety of extras designed to help you live a healthier life. We all know the importance of prevention. That's why all of our plans include many important preventive exams, screenings, and vaccines for a $0 copay. Your coverage will also include important health and wellness programs and services. These valuable extras are available to you at no additional premium cost and include tools you can use to stay healthy and feel your best, such as telehealth services for a $0 copay, personal health coaching, Health Manager powered by WebMD, preventive health reminders to ensure you're getting needed checkups, enhanced condition management programs, and access to SummaCare's 24-hour nurse line. And remember, with all of our plans, you are covered anywhere in the country for emergency, urgent care, and renal dialysis services, and up to $25,000 per year for emergency services outside the continental United States. SummaCare is one of the largest Ohio-based Medicare health plans with comprehensive coverage and choices. We provide quality health plans with personalized support and community engagement, and most importantly, benefits and services that help you live your healthiest life. Enrollment is easy. You can fill out an application and mail it to us. You can call us on the phone. You can apply online. Or you can visit us in person at a seminar, whatever works best for you. And you will only need to carry one card, your SummaCare member ID card. It's all you need at the doctor, at the pharmacy, and at the hospital. Let's get started today.